mentally and emotionally they have not recovered. So you will see this individual, they look normal, but they're not.
Well, there are some hidden dangers of concussions. Many people with a mild brain injury don't even realize how it's affected them.
From their memory to their personality, those changes can be far-reaching.
Now, concussions have been hot on the radar for the past few years, especially when it comes to athletes.
But there's a serious lack of awareness about how these brain injuries are affecting those who have them. And as 27 First News morning anchor Lauren Wood explains, recognizing the need for treatment can make all the difference.
Health experts describe concussions as a silent epidemic. The National Institutes of Health say there are nearly 4 million concussions each year from sports and recreation. Add in car crashes and falls and the number soars even higher. For 80% of people with a concussion, recovery will take about 3 weeks, but the other 20% may suffer more serious long-term problems, and many of them don't even realize what's going on.
I didn't have any broken bones. Nothing was bleeding. I didn't think it was that bad.
Of all people, Shannon Soroka thought she would know if she ever had a concussion. She's the office manager for a neuropsychologist. They deal with concussions all the time. But when someone T-boned her in a parking lot, she didn't even notice when the symptoms started creeping in.
I started to get crabby all the time, some from the headache. There were certain things that I just kept attributing to other factors. I was tired. I was foggy.
She kept forgetting things like her pen at the grocery store. Then one day it all came to a head when she went to pick up her son from a friend's house.
I call him, okay, Mason, come on. Let's go. You're not here. Yes, I am. I'm sitting in the driveway. Well, I don't know where you're at, but you're not in this driveway. I had went to a different friend's house to pick him up than when I had dropped him off at.
Shannon's boss, Dr. Carla Arlene, noticed the changes before she did and urged her to get a diagnosis. A week after the crash, doctors confirmed she had a concussion, but her struggle was just beginning. Even though she was cleared physically, no brain bleed, no structural damage, the cognitive symptoms kept piling on. Dr. Arlene says that's actually common.
That's why I call it a silent epidemic, because people are walking around with cognitive and emotional symptoms that people cannot see and are often missed by healthcare professionals because they focus on the physical symptoms.
Shannon was one of the 20% of concussion victims who did not recover within 3 weeks. But like many, she didn't realize all of her symptoms were linked to her brain injury.
They'll blow it off to say, oh, I'm just under stress. And they don't know the relationships between concussion and memory and personality changes.
You just feel dumb all the time.
What does that do to you emotionally?
It breaks you down a lot.
Shannon started therapy with Dr. Arlene, and now 8 months later, she's feeling more like herself.
I still cross words every once in a while. I want to say mathematics, but the word mermaid comes out of my mouth.
And both of them say seeing a psychologist for cognitive treatment is crucial.
Get treatment. Don't discount it. Don't discount your feelings and don't discount your symptoms. Don't make excuses for them or rationalize them.
Dr. Arlene says cognitive therapies for concussion patients are covered by most insurances. You do want to be checked out by a medical doctor first, though, if you suspect you have a concussion. They will make sure there are no brain bleeds or structural damage. Then, if symptoms last more than 3 weeks, she suggests seeing a neuropsychologist. Reporting in the studio, I'm Lauren Wood, WKBN 27 First News.